So I was just going to leave a comment on Enter's video about his stance on United States healthcare and Medicare for all, but I had way too many thoughts and I thought making a video instead would help me better convey them. To anyone watching this, do note, this debate, like many others, largely boils down to a difference in opinion. Enter thinks that healthcare isn't a human right and that Medicare for all isn't the right solution. I do think that healthcare is a human right and that Medicare for all is the right solution. I'm making this video to defend my position, not to throw mud on Enter's character or criticize his content or anything like that. Hot take, but I think people should have civilized discussion when talking about politics, so please don't use this video as a shallow excuse to justify any hatred you have for Enter. Just want to make this clear before I begin. Now, first things first is why Enter doesn't view healthcare as a human right.
Now let me be absolutely clear. This doesn't mean that I don't think that we as a society shouldn't try and take care of the sick and dying. I don't believe that food is a human right either, but that doesn't mean I'm against things like food stamps. We have to remember that these are benefits that we as a society provide, and they're not intrinsic rights that people are just born with. For example, for me to speak in and of itself, it doesn't cost me anything or anyone else anything. In order for me to not have speech, someone else needs to actively take it away. This is generally what the basis for a right is. Rights are intrinsic. If you're in the middle of the woods, for instance, far away from society, what you still have remaining are your rights as a person.
There are a lot of problems with this definition. First off, human rights are generally dictated not for what's intrinsic otherwise if taken away, but rather what's intrinsic to uphold the moral code and or quality of life that a society aims to achieve. If I were to go by your definition of what constitutes a human right, then I guess children wouldn't have the right to a roof over their head, even though by law they do, and if you can't provide what you're legally required to as a parent, child services are legally required to step in if they know about your situation. Education wouldn't be a right even though children are required to go to school by law, and clean water wouldn't be a right even though, by law, city water must be clean. I bring all of this up to show how your definition of a human right doesn't matter, even if your definition is technically correct, and if it did matter, well, let's say this. Your definition is what leads people to justify shit like African children not having a roof over their heads or access to clean water. Your definition is what leads parents to justify mistreating their children because they know that without them, their children would have no means of defending themselves. Your definition is the reason why we live in a society. Let me break this down for you. If you were alone in the woods, yes, you'd have the ability to talk and shit, but you'd also have the ability to make things. Making things is essentially a part of human nature because we're an intelligent species. Therefore, by your definition, we'd have the right to make things. Now here's the catch-22. Virtually everything we have in our society today consists of stuff made by humans, including healthcare, so we end up with three possible interpretations for your definition. Either everything made by humans is a human right, you have the right to make things but you don't have the right to possess what you make, or you have the right to make things and claim ownership of what you make but you don't have the right to something someone else makes and shares with you. The first interpretation is a problem because under that interpretation the entire concept of a human right is rendered meaningless, and the other two interpretations are a problem because we simply wouldn't make any progression as a species if we thought like that. The human race has lasted for so long because it's a core part of human nature for us to care about each other. If we didn't care for each other and opted to be loners, we wouldn't even be here right now. This is why I look at human rights as more of a societal construct and less of anything truly objective, and why your argument on what a human right really isn't that convincing to me or a lot of people who champion healthcare as a human right. Now before we go forward, I want to say this. Just because you think something is a human right doesn't mean you have to implement a universal system for it. All it means is that people should get access to that human right under any means necessary. For example, I think access to food is a human right, but I don't think food should be completely free at the point of service. Necessary foods tend to be inexpensive, and if our economy wasn't practically designed to fuck over poor people, I'm pretty sure any American would at least be able to afford the basics and still keep a roof over their heads, and even then we have programs for people in otherwise unfavorable positions as well as food drives. That said, I don't have similar views towards the national healthcare system. For one, people who are well off financially can still go bankrupt for medically related reasons. For another, people die every year because they can't afford health insurance, and these two factors wouldn't be so much of a problem if it wasn't for the fact that literally every other developed country has universal healthcare and they pay significantly less than us. This should be enough to explain why the United States needs a national healthcare system, but there are some common counter-arguments, a lot of which Enter brings up and that I will address here. One common counter-argument tends to be that a national healthcare system wouldn't work in the US, and as far as to why...
But what you have to understand is that the United States is very different from Europe in many ways. The most obvious one is population, and I'm talking about the population of the United States compared to any specific European country. The population of the United States overall is very similar to the population of Europe overall, but that's made up of many different smaller governments.
This is like the 5,836th time I've heard this argument, so I'm just going to say this. If you're going to factor in population when talking about Medicare for all, you also have to factor in the amount of hospitals in the country, the wealth that the richest people in the country hold, and the amount of taxes you could fairly distribute among the masses while still maintaining high-quality healthcare. Let's compare Canada and the United States by taking a look at their supply and population, which I find to be a good start in determining how effective a socialized system would be. Canada has a total population of 37.59 million people with a total amount of 1,400 hospitals. The United States has a total population of 328.2 million people with a total amount of 6,146 hospitals. If we were to ratio this, Canada would need at least 0.0003% of their population in order to have a chance at adequately funding the amount of hospitals they have. The United States would only need 0.0001% of their population. In terms of how our population would affect costs, there's nothing worth getting worried about. Now you go on to bring up other factors.
But another one is in our demographics. The United States has one of the highest obesity rates in the world, which leads to more health problems than you get in a place like Europe. As well, we have very high rates of smoking and drinking. Socialized medicine would be vastly more expensive than anywhere else in the world, just on that alone. You know, it's not like we're Japan where it's actually hard to get fat.
But here's the thing. If we establish Medicare for all in this country and we get to a point where we have to make more hospitals, we could literally double the amount of hospitals we have before reaching Canada's 0.0003% ratio. Seriously, it makes no goddamn sense for Canada to pay significantly less than us when it comes to healthcare. Even better, their healthcare isn't actually that bad. It has its problems, sure, but not only are these problems nothing compared to the problems countries like China face with their healthcare system, but their problems are often not even caused by universal healthcare in the first place. In fact, more universal coverage is often proposed to fix some of the problems Canada faces. And here's the really trippy part. Canada's healthcare system is expensive for them, but the amount Canada pays for their healthcare wouldn't even be that expensive for the United States because we literally have some of the wealthiest people on earth in this country. Even better, if our hospital amount to population ratio were to be the same as Canada's, we would still have higher quality healthcare and be paying less than what we pay for our current system. Here's an interesting little stat. We provide $1 trillion each year to account for all the hospitals in this country. If we were to double the amount of hospitals we have, we'd most likely be paying around $2 trillion. We're currently paying $3.4 trillion. Under our current system, we are wasting a little under $1.4 trillion. We're wasting it with $500 billion worth of organizations made to determine how much an individual pays for co-pays, premiums, or deductibles, and even more money's worth to pay for prescription drugs with jacked up prices from corporations lobbying and price gouging. Not to mention, lots of people pay so much more on an individual basis than they would under a 2% wealth tax system. This is money we waste. This is money we can save under Medicare for all. But that leads to the next argument Enter makes, which might have been a response to a comment I made on a previous video where he briefly touched upon his thoughts on healthcare. Here's the comment if you want to pause and read it. There's only one part that's relevant for this point.
One commenter on the video said that government is better because they don't have a profit drive like the insurance companies do. And this is a very complicated point. I mean, it really depends on what you mean by profit. Like, the government here does stuff for resources all the time. I mean, we have gone to war over oil, for instance, and companies lobby for extra privileges all the time. The government itself probably doesn't want any profit, but the individuals who run it most likely do. But no, the government itself does not need to turn a profit, which is a double-edged sword in and of itself, which is another video.
Now, if this was a response to my comment, I should have clarified myself better. So let me clear things up. When I said government would have more negotiating power over for-profit private corporations, I meant that corporations, through legislation, would not be able to charge over $200 for prescription drugs, they wouldn't be able to charge $2,500 for an ambulance ride, a hospital visit would be free at the point of service, and people would only have to pay a 2% wealth tax for their medical bills. And that's not even the only way we could pay for healthcare. This is basically what Bernie Sanders proposed with his Medicare for All bill, and this is what progressives like myself support. Yes, the government is full of lobbyists and corporate politicians, but if Medicare for All were to be passed, the only way they could continue being greedy is if they were to try and remove Medicare for all the same way they tried to cut Social Security. And since corporate politicians have struggled to cut Social Security, let alone remove it because of it being a policy that everyone likes, They'd rather not have Medicare for all in the first place and try to manipulate people through dishonest arguments and gaslighting. I'm not saying you're doing this for the records, but plenty of insurance companies, no joke, focus test arguments against Medicare for all just because they want to keep making more money and have more negotiating power over the government.
However, what the United States government does when it does get control of a system is cut costs. This always happens. People joke about the government running the DMV so well, so that healthcare would basically run beautifully under them. That's not entirely fair, as the DMV has its own problems that isn't exactly all governmental. A better comparison is the public school system here in the United States, which is government run. It's pretty much a joke to the rest of the developed world, even more so than our healthcare system. For example, teachers are paid very low wages, too low, so low that it's generally more expensive to become a teacher in the long run. I know that no one asking for socialized medicine wants doctors to work for free, that is an exaggeration, but you have to understand how much doctors are actually paid here. Most specialists are very lucrative positions, and people from all over the world come to the United States to be doctors here. And I mean, there's a reason for that. And you have to keep in mind, it's very expensive to become a doctor in the United States. And it's a career that isn't without enormous risk. And no, not just from catching disease. Doctors have to have malpractice insurance, for instance. Sometimes they screw up, but this country is full of people looking for any excuse to throw in a frivolous lawsuit. And of course, many doctors don't pay for malpractice insurance. The hospitals they work for do, which drives up the cost of medicine.
Wow, there is a lot to address here. Okay, first things first. Cutting costs isn't exactly the right term here. I mean, for starters, Medicare for all would save money compared to our current healthcare system, and if everything I said earlier wasn't enough to prove that, there are plenty of studies that back my position, so the government wouldn't have any reason to cut costs, unlike education and the aforementioned Social Security. But even if they did have a reason, they really wouldn't be cutting costs. The more proper term would be cutting corners. Like you said, the people who run the government are greedy and want money for the corporations they're representing. I brought this up in a comment I made, but people are tired of a government spending
$700 billion
to prop up the military-industrial complex while simultaneously struggling to implement a stimulus check for unemployed middle-class Americans because it's not like the government can't afford this stuff. They just don't want to. Second thing second, you bring up how teachers get paid like shit in this country. I agree. Teachers should be paid more, but there are a couple things to consider here. The first is that teachers wouldn't be paid any better if the government stepped out. In fact, they'd be paid less. I know this because teachers in private schools are, on average, paid less than teachers in public schools with an income disparity of around $10,000 to $15,000. This is precisely because public schools are public and have more jobs to fill. And while we're on the subject of private schools, they tend not to be better than public schools either. I know a lot of people say that private schools are better. The reality is, while they're better for teachers, they're not really better for students. One of the main reasons people tend to think private schools are better is because more private school students, on average, go to good colleges. That clearly doesn't speak for the school itself, and the only reason why that's considered a valid reason is because the actual goal of our education system, specifically high school, is to prepare students for college, which is bullshit. To prove why this is bullshit, teachers don't even have to have as much experience as a public school teacher in order to be a teacher at a private school. Any teacher out there would tell you that's a problem. Plus, a large reason why students in private schools are more likely to go to good colleges is because they can afford it. Like, private schools tend to be an upper middle class thing. I could rant for days, but to keep this brief, privatization is not the solution to our otherwise broken education system. The third thing I want to bring up is something you brought up. You brought up something very interesting. You said, and I quote, "It's generally more expensive to become a teacher in the long run, as well as it's very expensive to become a doctor in the United States." There's a reason for both of these. Well, in the case of international doctors, the expenses are probably more from coming here and getting a license and all that, but even for some of them, and any doctor or teacher born in the US, chances are they've had to deal with student loan debt. Why can't doctors afford malpractice insurance? Is it because it costs a lot? Well, not necessarily, for a doctor at least. It's probably more because they're busy trying to afford another debt the size of a fucking mortgage. See, doctors have to spend 8 to 12 years in a university before they can even get a fucking job. That's more than enough time to rack up a shit ton of student loan debt. Why is it more expensive to be a teacher in the long run? Well, it's probably because teaching is one of the very few professions in which you get less opportunities the more experience you have, and that can seriously fuck over your chances in paying off that student loan debt, since that student loan debt tends to be something you pay in the long term, even with how teachers are paid today. Chances are a lot of them would be better off or even doing fine with their pay if it weren't for student loan debt, though teachers should still be paid more because teaching is an important job and our society seriously undervalues it. Doctors make a shit ton of money, and a lot of them can barely even use their income. Point being, there are other bigger factors that go into the risk of these professions outside of public versus private in terms of pay, and that these are factors we could address while still aiming for a universal healthcare system. The final thing I want to bring up is simply that universal education isn't a bad thing. Like, a private school would be great for upper middle class Americans who can afford it, but chances are a lot of people in more urban areas without the proper income wouldn't even be able to get access to one. We need public schools. Kids should go to school. Enter goes on to bring up problems with the education system, like how schools don't teach you important subjects properly or at all, and the No Child Left Behind legislation, but these things aren't enough to convince me that schools shouldn't be government-run, or that we should have a more privatized solution to our education system, because I think the problem with our education system has less to do with it being public, and more to do with the fact that it's fundamentally broken to the point where these flaws can sneak in and fester, and that we should reform the education system altogether. Now that's a whole other rant entirely, and I don't want to spend the next 10 minutes explaining my problem with the education system, but I certainly don't want our education system to run in a similar vein as our healthcare system, because that's when we get kids not going to school, and that's not good. Education shapes society. The more uneducated our society is, well, let's just say that our shitty education system could explain a lot about our current political climate where a majority of Americans support one policy while voting for a candidate that's completely against said policy. It's so easy for mainstream media to manipulate the masses. The last thing we need is a lot of middle-class Americans not even getting an education because they're in some financial dead zone or something. That would be a nightmare. Also, I have no idea where you got the idea of malpractice insurance raising the price of drugs. I've never heard of that being a reason for our high drug prices.
And not to mention, some places in the United States are very partisan. We have very blue states and very red states. Mississippi, for instance, has been heavily criticized for how it handles abortion. It has only one clinic in its entire state, and it's only because it's legally obligated to. Would you really want this government to be in total control of how abortions get done? And I'm going to take a swing at the other side too. So far, one of our glorious attempts at socialized medicine here is if you don't have insurance, you end up getting fined. So if you can't afford to get insurance, you get hit with a fine because you can't buy insurance. This is what our leaders come up with when they try to get socialized medicine for everyone here in the United States.
There's a very simple fix when it comes to anti-abortion states, and that's through improving federal law to where more access to abortion clinics are given. One abortion clinic per county instead of one abortion clinic per state would be one way to go about this. But regardless, abortion is legal in all states through federal law. Even if states have a clear bent against abortion, they still can't deny service to anyone who wants an abortion outside of monetary reasons, because that would go against federal law, and the state does not have power over federal in this instance. As far as your other point of consideration goes, I find it to be a non-argument, honestly. For one, the government doesn't come up with stuff because they want more socialized medicine, they come up with this stuff in response to those who want more socialized medicine. By all accounts, stuff like Obamacare came about through corporate lobbyists and, potentially, Obama selling out after accepting super PAC money for his 2008 campaign, not because they actually thought that would be the best way to offer socialized medicine. For another, Medicare for All is meant to fix this stuff, so we no longer deal with it anymore. Once again, very simple stuff. Maybe I'm misunderstanding though. Perhaps the argument is that we can't rely on our government to improve our healthcare system on the basis that they're untrustworthy. I disagree with this solely on principle. I believe the government absolutely has a responsibility to maintain a quality of life that allows for a functional, prosperous society. Let me make it clear, though, that there are some things that are better off without government interference, whether it be their involvement in other countries or matters like Guantanamo Bay or the CIA in general. Hell, like I said, I wouldn't want food to be free at the point of service, nor would I want a house to be free at the point of service. But when it comes to healthcare, well, the government already pays for Medicare, Medicaid, VA, TRICARE, among many other things that amount to 2/3 of our healthcare costs. All an insurance company amounts to, at the end of the day, is an unnecessary middleman. The government should be 100% responsible for our healthcare system, the same way they're responsible for the police, the military, our roads, our infrastructure, our schools, and other essential parts of our society. And if they fail to meet an expectation of quality for these necessities, it's either the fault of our system or the fault of corruption. In which case, if we are unable to combat these obstacles and have the government fulfill their responsibilities properly, then I consider that more of a bad omen for our society in general. We can only work around the government for so long until we either can't or it becomes inconvenient to.
Like I said though, the American healthcare system has plenty of problems. I'm not going to say that this country doesn't have problems, ever. It does, and I will criticize it any time of the day. It just happens more and more lately where people want any solution instead of the right solution, and that's getting more and more frustrating as time goes on.
Look, I get that our current political climate has become more radicalized the past couple of years. I'll even concede myself that I've been pushed more to the left throughout last year, and that there are certain policies I have that stem from me wanting to look for any solution, not being sure if it's the right one or not. But Medicare for All is not one of those policies in the slightest. If anything, I'd say Medicare for All is one of the most basic political positions I could possibly have. Not only is it an extremely popular idea in the States, but it's a proposal that I look at with a lot of pragmatism, ironically enough. A lot of people who support Medicare for All don't just support it willy-nilly. They were either convinced by someone else who probably spent hours at a time explaining it to them, or they did a lot of research on their own and came to the conclusion that Medicare for All is the right solution. Personally, I find it baffling how Medicare for All is even a debate in this country. I just don't get it. Not only do I think it's the right solution, I think it's fucking obvious. Not saying it is, but I am saying that's how Medicare for All appears to me. This is pretty much the only problem I have with Enter's video on an objective level. Kindly don't undermine my political beliefs.
I know this is going to be ironic considering what I just said, but I do have to defend the American healthcare system just a little bit. It has problems, but it does have perks. The American healthcare system is not the worst in the world. Like I said, if you can afford it, it is the best in the world. One thing about capitalism is that it does drive some people towards excellence. That's why capitalist countries tend to have the most innovation. The United States basically subsidizes the rest of the world's healthcare through innovation, which is only really possible in a free market. Government control breeds complacency. Like I said, non-necessary becomes non-existent. The fact that pharmaceutical can be patented, for instance, means that a profit can be made on it exclusively by a company, giving them plenty of incentive to try and discover as many of them as possible. When we hear about drugs being exorbitantly expensive, it is definitely bad, and we should do something about that. But the alternative to overpriced drugs might be the drugs not existing at all. The drugs that many other countries are getting for cheap were most likely discovered and even created here in the United States.
Now you're opening up a whole can of worms here. Excuse me while I rant about capitalism for the next minute or two. Yes, the general idea of capitalism is that it encourages more innovation, but this is a double-edged sword, especially when we're dealing with late-stage capitalism. Late-stage capitalism is ultimately the end result of capitalism where a handful of corporations team up to control a significant amount of the market, corrupt the government, and establish an oligarchy in its place. Innovation out of necessity turns into greed for greed's sake. Consequently, innovation from smaller businesses or even an individual gets not burned out per se, but outmatched. And because these drug companies are ultimately working together and have no noteworthy competition from anyone else because that's how powerful they are, innovation ultimately becomes unnecessary. Unlike what you say, however, this does not mean that drug companies get complacent. Instead, they get dirty. This is when we get into things like the war on drugs. The war on drugs was initially started out of general fear-mongering. However, ever since Ronald Reagan's presidency ended, people have been largely against it, and I guarantee you we wouldn't even have a war on drugs today if it wasn't for the fact that drug companies profit off of it. You have politicians like Joe Biden, who are supported by health insurance companies through super PACs, going on the debate stage and spreading the myth about marijuana being a gateway drug, even though that's long since been disproven. This is because health insurance companies and drug companies profit off of marijuana being illegal, since marijuana is a more effective natural pain reliever than anything the drug companies could come up with. You can fill in the dots from there. This greed has led to two consequences. The first is that states have realized that this is bullshit and some of them have tried to legalize medical marijuana. However, recreational marijuana in some states have not been legalized, so we end up getting this complicated, convoluted system for patients to even get their hands on medical marijuana in the first place, which is not in place for other, less effective prescription drugs. It's a huge hassle that we wouldn't even have to deal with if marijuana was legalized in all states. The second consequence we have to deal with is good old-fashioned racism, but that's neither here nor there. And this is far from the only example of drug companies playing dirty. The opioids epidemic, for instance, was directly caused by drug companies selling opioids through shadowy means. This was actually taken to a court of law, which ruled that these drug companies were responsible for getting thousands of people addicted to opioids. Justice served, right? Well, sure, until you realize that those people are still addicted to opioids. Oh, and wouldn't you know it, drug companies started providing medication for people dealing with opioid addiction. So to put this into perspective, drug companies get innocent people hooked on opioids, they get sued for it, then they sell opioid medication at a price that they ultimately control, meaning the prices are high enough to probably pay back their legal fees and still make a profit, and the people with opioid addiction get fucked in the process. That's capitalism for you. Capitalism fucking sucks, and serves as an arms race to the bottom more than it does incentive for innovation. I personally don't subscribe to the belief that one needs a monetary goal in order to innovate. If someone wants to innovate, they'll innovate for the sake of doing it or for the sake of others. Like I've said before, it's a part of human nature, and it's something that capitalism inherently denies. The only way I could see US drug companies becoming complacent is if they were involved in some disastrous trade deal, and even then, that would still benefit them under capitalism. And make no mistake, corporations might say they must charge these high prices because of the amount of research that goes into making these drugs, but they ultimately just want more money, and it's so transparently the case when they don't even spend the most on research. Amazon does, and they offer pretty cheap prices, which must be so devastating for them considering Jeff Bezos is the richest man in the world. Have I mentioned that I'm a democratic socialist yet?
But with all this said, I do not believe that healthcare is a human right. Keep in mind, I'm not saying that we should just let people die on the street. Human misery is a bad thing, and we as a society should try and prevent it. What I am saying is that we need to understand that a doctor needs to be compensated for it. The equipment he uses needs to be paid for, and the people who make and discover the drugs he uses need to break even at the very least. Declaring it a human right means that you are entitled to all of that work, and it does a disservice to all of the hard work and resources that it takes into taking care of someone's health.
I don't see how. If a society is entitled to certain work, that generally tends to mean that the work is extremely valuable to keeping our society running. A society is entitled to a good postal service, for example. The post office has a lot of resources that go into it, but that doesn't mean the post office is worthless because it's a public system. Quite the opposite. Publicizing our healthcare system wouldn't be taking away its value, it'd be a recognition of its value. And please, if there's one argument that drives me up the wall, it's the how are you gonna pay for it argument. And if you've paid attention to any of my arguments throughout this video, you'd know why. Yes, we know this stuff costs money. You tend to pick that up after a near century of fighting for what you believe in. Seriously, we've been discussing Medicare for All since the days of Franklin D. Roosevelt, and that's just exhausting to think about. Like I said, I'm baffled that Medicare for All is even up for debate anymore, especially when the proposition lately has been seen as less of a possibility and more of an inevitability. Like, sooner or later, we are going to have universal healthcare in this country. If our current political climate isn't enough of an indicator, we might as well just wait for time's course to show us which healthcare system is better when Medicare for All is established, instead of having this debate in the first place. But regardless, I'm making this video because Enter doesn't strike me as a malicious person. He doesn't strike me as a corporate shill or an alt-right fascist. I think he just wants the best system possible, and I can respect that. At the very least, I don't think trying to have a discussion with Enter would be like trying to have a discussion with a brick wall, so a reasonable discussion seems plausible with him. Therefore, my final message to Enter, if he's watching this, is a request to take my counter-arguments into consideration, and that I hope he has a good rest of his day. That's all.